Choosing the right health insurance can be confusing. In this video, by the Wisconsin Department of Employee Trust Funds, we'll help you with the first step, choosing a plan design. This video is for both state and University of Wisconsin employees. You can think of a plan design as a package. It includes how much you pay per month from your paycheck, how much you pay when you visit a healthcare provider, which services your plan will help you pay for, if you can see providers locally or nationwide, and if you have out-of-network benefits. We offer 4 plan designs. Each plan design will help you pay for the same services like doctor's visits, labs, x-rays, and prescriptions. How much a plan helps you pay for a service and how much comes out of your paycheck depends on the plan design you choose. Let's start by talking about the 2 most common plan designs, the IYC Health Plan and the High Deductible Health Plan, or HDHP. The IYC Health Plan costs more per month than the HDHP. You pay more each month so that when you visit a doctor, fill a prescription, or use another service, your plan will cover the costs right away. This makes your costs more predictable when you need care. The HDHP costs less per month, but your first few bills might be a shock. You will pay the full cost of most visits or prescriptions until you meet your deductible. After your deductible, your plan will start covering some of the costs. There are a few times when your plan will start covering costs sooner. Preventive care is covered at 100%, no matter which plan design you choose. Preventive drugs, such as drugs to stop smoking or lower cholesterol, are covered at 100%. Contraceptive drugs are covered at 100%. And your plan will help you pay for some maintenance drugs, such as drugs to help you manage diabetes or high blood pressure before you meet your deductible. To learn more about these exceptions, see the related resources. When you enroll in the HDHP, you will have a health savings account, or HSA. With an HSA, you can set aside money pre-tax to pay for eligible healthcare expenses, including office visits, prescriptions, and eyeglasses. Your employer will add money to your account each year if you are eligible. Money is deposited evenly throughout the year. You won't be able to use the money from your HSA until it's deposited, so make sure you have another source of savings while you are building your HSA fund. A good rule of thumb is to have enough saved to cover your deductible. Money in your HSA is always yours. Any money you don't spend can grow in your account for future expenses. And you can take your HSA with you if you change jobs, retire, switch plan designs, or change health plans. The last decision point is where you want to get care. With the IYC Health Plan and the HDHP, you can only see providers locally unless it is for an emergency or urgent care. By locally, we mean close to home, and that could include counties and nearby states. If you need a larger coverage area, consider the Access Plan designs, Access Plan and Access HDHP. The Access Plan designs covers the same benefits but costs more because they offer more provider access within Wisconsin and nationwide. Exactly which providers, hospitals, and clinics you can go to is determined by your health plan and is known as the network. You'll decide on your health plan after you choose your plan design. The IYC Health Plan and HDHP have many health plans that cover only local, in-network providers. Make sure your providers are covered by checking the provider directory. On the other hand, the Access Plan designs, Access Plan and Access HDHP, have one nationwide health plan with a large provider network. It's okay if your providers are not in network. You can still see them, but it will cost more. Now that you've learned about your 4 options, it's time to decide. First, do you need nationwide or out-of-network coverage? If not, it's between the IYC health plan and the HDHP. If you do, you'll want to think about the access plan designs, Access Plan and Access HDHP. Then you need to decide if you're comfortable paying more when you visit the doctor or get a prescription so that you can have less money coming out of your paycheck. If so, think about the HDHP. If that makes you feel uncomfortable or you do not have enough savings, the IYC health plan may be a good fit. Still not sure which plan design option to choose? The case studies below this video show how participants' plan design choices work out over a few years. Want something more personalized? Use Benefits Mentor, our virtual benefits counselor. It asks a few questions, crunches some numbers, and points out what makes the most sense for you. Click the Benefits Mentor link in the related resources to get started.